Appreciate that. For those of you that I haven't met before, my name is David Brandt. I'm a financial advisor with California Wealth Transitions. I'm here in the Brea office, and we're very fortunate to have Tyler Schmuckle here to join us to talk about Medicare. Tyler's been a great resource, as Blake mentioned, both for us as advisors and for our clients. He's been working in the Medicare space for over a decade. That is his focus. That's all he does. He's a resident of San Diego, and it's really great to have him help us navigate all of these Medicare questions. Tyler, I think what I'd like to do is just start with asking a couple of questions and then let you go from there, if that's okay.
Yep.
So if you would, could you give us a timeline? If I'm about to turn 65, what kinds of things should I be looking at? That's my first question. The second would be, could you give us a quick overview of Medicare and how does it compare with the medical program that I had at work potentially? And then the third question would be, walk me through signing up for Medicare. What are the steps? What are the decisions that I'm making?
Yeah. So I'm going to share my screen here and show everyone a couple slides. I think a visual just helps with everything instead of me just spewing. So let me get my screen up here. Hey, Wayne, how you doing?
I'm doing well, Tyler, and I wanted to just make a real quick comment if I could. I've been dealing with Tyler for probably over 10 years. I'm a CPA, and I've referred, I think, 7 or 8 clients to him, and they all come back with rave reviews. So if you need an endorsement or anything like that, I could not recommend Tyler strongly enough. He's the man when it comes to Medicare. So that's my 2 cents.
Oh, thanks, Wayne. And you have to say not a sponsor when you say that.
Yeah, I'm not a sponsor.
Okay. Well, thanks for that little plug.
That's perfect. We didn't even set him up with that. That's just a natural endorsement. That's great.
He's one of the main reasons I'm attending today, because I met him years ago at a trade show, and he switched over my personal Medicare, and I haven't looked back. I've been very, very pleased with our relationship.
Yeah. Well, thanks for that, Wayne. So everybody I meet is turning 65. That's the magic number with Medicare. And so the time to take action is going to be 3 months before your birthday month. And so everybody I'm meeting with now is turning 65 in October. And the first question I always ask everyone is, how are you getting your insurance now? Because if you're actively working and there's more than 20 employees in the company, you can delay Medicare and really you don't have to take any action. And so there's a whole different, step to take for those individuals, which I'll go over a little bit. But let's just say you're retired, you're going into Medicare your birthday month. So 3 months before your birthday month, you're going to be able to take action. If you're collecting Social Security, your Medicare comes to you automatically. They give you Part A and Part B automatically. Your Medicare card just arrives in the mail about 3 months before your birthday month. And so for those who are already collecting before 65, collecting Social Security, you really don't have to do much as far as getting your basic Medicare going, A and B. If you're not yet collecting, then you have to take action on that part. And so to apply for Part A and Part B, you're going to do it 2 different ways. You can do it online through the Social Security website, or you can call the Social Security office, which isn't very fun most of the time, and you could set up a phone appointment. And so here in San Diego, I have the direct phone numbers to all the different Social Security offices because that's who is administering the Medicare. They run the Medicare premiums and they run the first part of Medicare, Part A and Part B. So you're dealing with the government. And so that's what makes Medicare a lot different than your normal insurance, is that you're dealing with the government. And so your first enrollment period, they call it the initial enrollment period, is going to start 3 months before your birthday month. And then they give you a buffer. They give you your birthday month and up to 3 months after. And so, you know, you want to take action ahead. And if you do, your Medicare will start the first of your birthday month. And so for these people, these are going to be people who are retired and are going to go into Medicare on their birthday month. Now, if your birthday is on the first of the month, your Medicare is going to start the month before. So if your birthday is October 1st, 1958, you're turning 65, your Medicare would actually start September 1st. So the first questions, you know, we go over is how are you getting your insurance? If you're working, you're going to have the option to stay put on the work insurance or go into a Medicare plan and go that route. So the other enrollment period is going to be if, let's just say you're still working, you're going to stay put on your work plan. And now you're 70 years old and you're going to retire in October. Well, the same timeline goes for that as well. About 3 months before you retire, you're going to want to start working on getting your Medicare going. And so to get your Medicare going, if you've delayed, you're going to have to fill out these 2 forms here. So one of them is this L564. This one, you fill out section A on the top. Your company has to sign off that you've had coverage from them. And then you can go into Medicare mid-year. You don't have to wait for any special enrollment period. You have your own. So that's one form there. Sometimes that could take a while to get back from your company. So it's good to get a head start on that form. The other form is just for you to fill out. They call it the 40B. That one is right here. And this one you just fill out. If you already have Part A only, you're going to have a Medicare number. If not, you could leave that blank. And then you're going to want to put your requested start date down in the remarks. But these 2 forms together are going to be faxed to the Social Security office, and they're going to initiate enrollment into Medicare. So this is the first step. So it might help clarify if you guys are all new to Medicare, let's clarify what Medicare really is, which is Part A and Part B. And I think it'll really help to understand once you know what Medicare is and what it covers, to know what you're getting into here. So Medicare has 2 parts, Part A and Part B. And if anyone has questions, I don't know, feel free to jump in. If you want me to go over something in more detail, I can. So maybe raise your hand or jump in. But this is awesome here because nobody talks about what the benefits are of straight Medicare. And these are really hard to find. If you look in the Medicare and You book, or you look on the Social Security website, it's really hard to find what do you get with just straight Medicare. And so I love this slide because this shows the 2023 benefit for Part A, and then we're going to go over Part B. So Part A of Medicare, they give you this for free. As long as you've paid into your Medicare taxes for at least 10 years, you get Part A for free. Part A is going to cover you in the hospital or in a skilled nursing facility. So the bummer about Medicare is that there's a lot of out-of-pocket costs. The nice thing about Medicare is that you can go to any hospital across the country as long as they accept Medicare's payment, which is going to be pretty much every single hospital. So if you're hospitalized and you have just straight bare bones Medicare, if you're just in there one night, it's going to be a $1,600 bill, which is a little bit expensive. This will cover you up to 60 nights. So if you're in there a couple of weeks, it's the same price, it's $1,600. You have to pay the first $1,600. That'll reset every 60 days. You're out of the hospital. So it could come up more than once a year. If for some crazy reason you're in the hospital more than 60 days or 90 days consecutively, it goes to a daily copay. And so these numbers they can add up. And you can see how they add up. This is the reason why they have so many different plans to supplement Medicare. And that's where I really come in. I don't work for Medicare. I work as a broker, and I broker out all the different Medicare supplement plans and prescription drug plans. So you can see here the cost could add up on straight Medicare, but you can go to any hospital, very flexible. There's also skilled nursing coverage up to 100 days. They'll give you the first 20, and then it's a couple $100s a day for that. So, but again, any skilled nursing facility on straight Medicare. Part B is going to have a premium. This premium is going to be based on your income. And we're going to look at those income amounts on the next slide and the Part B premium amounts. Most people are paying the base rate of $164.90 a month. But if you're a high earner, then you will be paying more than that per month for your Medicare. Part B is going to cover you for any outpatient visit. And so they have a $226 deductible. So your first visit to your doctor, your specialist, you would pay the first $226. After that's met, Medicare covers 80% and you would pay 20%. And the problem with that 20% is there's no limit to how much you can be charged. And so that's not very good insurance when you can just get a huge bill. And so, you know, that's where all these Medigap plans and Medicare supplement plans and Medicare Advantage plans come in, really to cover the 20%. So that's pretty much Medicare in a nutshell. They also have these Part B excess charges where there's a few doctors who can charge more than what Medicare allows, and they charge 15% more. It's called the Part B excess charge. There's a few supplements that cover that and some that don't. So it comes into play, but you know, it's very rare. So from straight Medicare, or let's go over the premium amounts here.
Tyler,
Yes.
so Medicare is only covering medical expenses. It doesn't cover dental or vision, correct?
Yes. So when you have just basic Medicare, it's A and B. It's only going to cover you in the hospital, in a skilled nursing facility, or at a doctor's office. So straight Medicare doesn't cover even prescription drugs. They don't cover vision. They don't cover dental. They don't cover hearing. It's pretty much just the medical that you're getting. That is correct. So you can see here at the top for 2023, they're looking at your 2021 modified adjusted gross income. So what they're looking at on your 2021 tax return is your adjusted gross income plus tax exempt interest. And so they're going to look at this every November to determine the following year's premium. So this November, the most recent tax return they're going to have is 2022. So they're going to use that to determine your 2023. And if you're filing as an individual, you can see here, it's pretty easy to get up into these higher brackets. The first threshold is 97,000 or less. If you make more than 97,000, you're going to pay more. So these are the Part B amounts over here. So if you're filing jointly, it's just double, 194,000 or less, you pay the 164.90. So you'll see here in the higher brackets, it goes up pretty quick. So they have both a Part B IRMA, which is income related monthly adjustment amount, and a Part D IRMA. If you have a prescription drug plan, you will be charged more for being a high earner. So there is a little trick here for people who are retiring, whose income is going to go down. There's a way to appeal this year instead of waiting 2 years for your income to catch up. So they have a Part B appeal form. There's a few, it's a very simple form. It's really just this one page is all you fill out. But life-changing events of work reduction or work stoppage will allow you to appeal this. And so instead of 2021, you would write in 2022 here, or even your estimated 2023, and your adjusted gross income and tax exempt interest, and submit this into the Social Security office. So they're pretty lenient on honoring the appeals, but they will hold on to it and make sure that it matches up with your true modified adjusted gross income. So if not, if you appeal it lower than it actually is, you will be billed the difference back. So that's a nice little trick there for people who are retiring and whose income is going down significantly to appeal that down. So going back here.
So Tyler, that's something that we all need to keep in mind, that every year that's going to be adjusted based on 2 years previous tax returns. So if we have a spike during retirement and income, said, you know, we sell a house or something happens and we have a spike, that's going to impact our Medicare premiums.
Correct. Yes.
Okay.
And on the appeal form, it's kind of tricky because there's no like sell of property on here. It's loss of income producing property. So if you sold a rental, you could appeal.
right?
But if you sold your own residence, I mean, you can try to appeal, but they might not accept that one. So it has to be one of these 8 life-changing events to get you to appeal. But yeah, that is, yeah, it's a nice trick when it works.
Yeah.
So, okay, so from the straight Medicare, you're going to have 2 routes to choose from. And really, it comes down to if you like flexibility of a PPO, you stay on original Medicare. If you're okay with an HMO and a provider-specific network, then they have these plans called Medicare Advantage. And so we'll start on the original Medicare side and how this works. So on original Medicare, Part A and Part B is going to be the primary medical, which allows you to go to any doctor across the country. It's very flexible. So it's almost like a PPO on steroids. There is no out-of-network, in-network. Everybody who accepts Medicare is in-network. With all of the out-of-pocket costs, the 20% and the hospital deductible, you can purchase a secondary medical. They call these plans Medigap. So it makes it very confusing because they have Plan A and Plan B to supplement Part A and Part B. But to make it simple, the top plan, the Cadillac plan, used to be the Plan F. This plan covered every single gap in Medicare. They called this the all-you-can-eat buffet plan. You can go to the doctor as many times as you want and you don't get a bill. Because there's no bill and there's no skin in the game, the government went away with this plan. If your Part A start date is after January 1st of 2020, you can no longer purchase this Plan F. So now the top plan and a very popular plan is this Plan G. So I don't know if you can see my screen. It's pretty small on my end, but the only difference here between the 2 plans is this missing gap here, the Part B deductible, which is a $226 deductible is all. And so once that deductible is met on the Plan G, you're going to have no bills for any visit after that. So this plan is still a very good plan. And with the Plan F no longer offered, the premiums have been going up much faster on the Plan F than the Plan G. So the Plan G is the top plan. The next one down is the Plan N. This one's kind of the middle of the road plan. This plan, you have a copay after the deductible, and then you have an emergency room copay, and it does not cover the Part B excess charges. If you run into that, that's all on you out of pocket. The bottom of the barrel Medigap plan is the high deductible version of this Plan G. So what that plan does, it just puts a limit to your out-of-pocket costs at $2,700 this year. So really on that plan, you're just staying on the straight Medicare benefit with a cap at $2,700. So that's the very least Medigap. So the price range for these, the Plan F and Plan G, depending on your age and zip code, they're anywhere from $200, $250 a month. The Plan N is like usually $25 a month cheaper. And then the Plan G, you can get anywhere from like $40 to $70 a month, in addition to that Part B premium. So these lettered Medigap plans, they're offered by 25, 30 different companies. And so you can shop it out. And, that's where my job comes in, is to help you compare the different Medigap options, whether it's, Blue Shield or Anthem Blue Cross or United Healthcare, HealthNet or Cigna or Aetna. There's a lot of different companies to choose from. No matter which one you choose, Medicare is going to be the primary payer. And so they're the ones who dictate who you can see and what's covered. So the Medigap really doesn't dictate much as far as what's covered and who you can see. It's just piggybacking off of Medicare. So the company name isn't so much important as the stability of the company and the premiums. So that's the medical when you're on this side of Medicare here. Blow this up. There's no prescription coverage on these Medigap plans. So when you're on this side of Medicare, you actually have 3 different insurances. You have 2 for medical and 1 for the pharmacy. And so the prescription drug plans in California, there's 26 options. They get very tricky. They all have a different set of covered medications. They all have different premiums, deductibles, different copays based on tiers. And so a great resource for the prescription drug plans is Medicare.gov. And I can show you here, we can do it live. We're going to go to Medicare.gov and we can take a look at some of these plans. Find health and drug plans. We can use Carmel Valley here. All the plans are going to be off of California, but I'll just give you an idea of what's out there. So you can even put in prescriptions on this program, and it's going to line up the prescription drug plans in order based on your total out-of-pocket cost. So if you want to throw a couple in, I'll show you. Like we could put amlodipine, or I'm just going to throw some generics out there. We can put atorvastatin. We could put, let's put lisinopril. And you can see here, you can also choose the dosage, which sometimes does make a difference on the price. So it gets very specific. You can also put in the quantity if you're taking 1 a day, 2 a day, 3 a day. You can change that as well. So let's do one more. Let's put in like levothyroxine.
Tyler, it's kind of scary that you know the names of all these drugs just off the top of your mind.
Well, you know what? This is a huge part of it is just the prescription drug costs. So this is what I do all open enrollment long is review these plans. The major problem with the prescription drug plans is they're a 1-year contract on the calendar year. So every year they come out with new plans and they're always a little bit different. So sometimes, you know, your prescription drug plan's just working great. And then you go to use it in January and one of your medications isn't covered. And so it's important just to do a quick review to make sure everything is staying stable for the following year. So I'm just plugging these things in most of the time.
So are you saying that we need to review our plan every single year?
I mean, it's good to. I like doing it for my clients because, you know, if something changes and they don't know about it, it's on me. And so I always like doing a quick review. I save all of my clients' prescription drug lists. What I'll save is a copy of their plan. So like I'm going to put in some pharmacies here. Let's get a CVS in here too. And then this is really cool. So it's going to give us a breakdown of these plans here in order on the total out-of-pocket cost, including the premium each month and the copays at the pharmacy. And this is for the remainder of this year. So this is assuming you're starting August 1st, but we can go into the details, and this is what I save for each client. So it tells you the pharmacy, if it's preferred or just standard. If Rite Aid is going to be more expensive because it's not preferred. And then it tells you the price per each prescription here. And you can see Rite Aid is way more expensive on this plan because it's not a preferred pharmacy. And then you can come down here and you can actually see each pharmacy's costs here. So this plan, these prescriptions are so generic, they just give them to you for free, all these plans. But if you put in a drug like Eliquis, which is a very expensive drug, this whole thing is going to change. Oops, let's go back. Let's add. So this is a newer heart medication. Oops, Eliquis, and it retails at about $600 a month. And so if you're taking any brand name prescription like this one, then there's going to be bigger numbers that come into play, deductibles, things like that. So you can see here how the plan just flipped. It's a totally different plan up top. This plan is $69 a month, and this is the total out of pocket. So the biggest thing with this plan, there's no deductible on this plan, where a lot of these plans are going to have a deductible, $505 deductible. So this plan with Eliquis, if we look at it, it's going to show us the pharmacies. Not a lot of companies work with Rite Aid. Cigna does, but not a lot of them do. But if we look at CVS, see this thing retails for $600 and they only charge you $47. So this plan would be great for this year if you're taking Eliquis, but who knows what's going to happen with this plan next year. If they get a bunch of members on Eliquis and they don't like paying for it, they could just say, you know what, we're dropping Eliquis from the formulary next year. So you have to kind of be on it, especially if you're taking the expensive ones. If you're taking the cheap generics, it's not so much of a big deal because you could probably find a coupon to get those just for a couple bucks anyway. But for this one, there's no coupon and you're getting a smoking deal at $47. So you want to make sure if you're on some expensive medications that you do review these each open enrollment. So this is something I do with everybody. Looking at Medicare.gov, you get every single plan. And then I'll just save a copy of this for each client so I can come back and plug them in quickly. And we just sometimes do a 5 or 10 minute review is all, and it goes pretty quick.
And all of these plans are individual plans. So I might have a different plan than my spouse does. Is that correct?
That is totally correct. Yeah. Yeah. And if you're taking different medications, then you probably will have a different plan because these prescription plans, they don't cover every single medication. They all have a different set of covered medications. So yeah, they get really tricky. There's also something called the donut hole where they're going to track your retail cost of these medications you pick up each month. So in this situation, this is a $600 monthly retail. Once that number hits $4,660 this year, you go into the donut hole, or the coverage gap. And so instead of a $47 copay, they show you what's going to cost here. You're paying 25% when you're in the gap. And so it goes up to $151. So mid-year, all of a sudden you go to the pharmacy, and I get these calls all the time. Hey, how come my prescription is $150? It was $47 last month. Well, that's because they've hit the donut hole. And this is across the board on every single plan, this donut hole. And so it's not going away anytime soon. They talked about adding it into the Inflation Reduction Act. But what they are going to do is they're going to cap your total out of pocket for prescriptions at $2,000 beginning in 2025. So that was part of the Inflation Reduction Act. They also include now the shingles vaccine, which was not included before. That used to be a tier 3 medication, and people would have to pay through a deductible. It's like a $175 vaccine, and you have to get it twice. And so that didn't make a lot of people too happy, but now it's going to be covered starting this year. It's covered in full. So there's a lot of weird, funny rules with Medicare and the prescription drug coverage. Another one is if you're taking opioids, your first fill of the year, they're only going to give you 7 before they give you 30. So you have to go in the pharmacy twice. So a lot of funny rules. So some people, if it's cheap through GoodRx, you could just get a medication through GoodRx and bypass all these Medicare rules. So GoodRx, you could just get a coupon for pharmacies and take the coupon in and don't even charge your prescription drug plan. But if you tried to put in Eliquis in here, let's see, it's still going to cost you $550. So you're going to want to use your prescription drug plan for that medication. So yeah, so that's the prescription drug side. With this program, if you're interested in the Medicare Advantage side, you can also look at the Medicare Advantage plans and see how their prescription benefit works. So this is a scan plan. They're popular with UCSD, but you can see there's no deductible and the prices are a little bit cheaper. They have a $25 copay. So, even on the HMO side, it's still important to look at your prescription drug coverage because those change each year as well. So that's kind of a good segue into the Medicare Advantage side. Let me go back to this slide here.
And none of these additional plans add in dental or vision or hearing?
So The Medicare Advantage plans, most of them do. So the scary part about Medicare Advantage is that you're actually opting yourself out of Medicare Part A and Part B. So you still have to pay for the premium, but you're no longer using A and B for your insurance at all. Instead, you're going into a provider specific plan, just like that scan plan. And so they're going to have you choose your primary doctor, just like any HMO. And that doctor is going to be on your ID card. And you're going to need prior authorization and permission to get into other doctors. So you need referrals and things like that. But what a lot of people like about Medicare Advantage is they don't charge any extra for these plans. And so you'll have to pay A and B premium, but in addition, there's no extra premium. So there's 0 premium plans. There's no deductibles. You're just going to pay a flat copay. So I can show you. Let me show you a plan. I'm not supposed to just show plans without getting this scope of appointment form signed, but we're going to do it anyway. Let's see here.
And is there a big disadvantage from going back and forth? Can you go back and forth between?
Yeah, that's a great question. And that's another curveball where these Medigap plans, they give you 6 months from your Part B start date to get into a Medigap without any health questions at all, to guarantee acceptance. If you start with Medicare Advantage, you miss that 6-month window and later decide to go in to a Medigap, you could be denied. So they're going to ask you recent cancer, stroke, or heart attack. Pre-existing conditions could come into play when going from a Medicare Advantage to a Medigap policy. So there's a few rules where if your doctor leaves the network, they'll let you in. If the plan that you're on just leaves town, you can go into a Medigap. So there's a few rare cases where you can go in guarantee to a Medigap without health questions, but you could also be stuck with the Medicare Advantage plan if none of those happen. So let me pull up Medicare Advantage plan. Let's see. Just do, here's a Scripps and UCSD plan, this Blue Shield plan here. So this plan by Blue Shield, this is a San Diego County plan. So they're only going to contract doctors in San Diego County, but they do have Scripps Clinic, Scripps Coastal, UCSD, a few other medical groups. But wherever your primary care physician falls, whichever medical group they're in, they can only refer you to that same medical group. So if you're with Scripps Clinic, they're only going to refer you to a Scripps Clinic specialist. They can't refer you to Scripps Coastal or UCSD, even if those doctors are in the plan. You would have to switch your primary care physician first, which you can do on these throughout the year, and then get a referral from there. So it's almost a 2-step process to get to a different medical group. So they're much more restrictive with who you can see because you go from this whole national network down to one small medical group in San Diego with these plans. So these plans work great until you actually need a bunch of care because you're not paying for it. It's $0. So you can see here at the top, monthly plan premium 0 and no deductible. They'll put these max out of pockets on these plans because you do have bills. So this plan will cap you at $3,400 for the year. So if you have hospital stays, which will cost you still $295 a night for the first 7 nights, a week-long hospital stay on this plan is going to cost you a couple thousand. So this plan is just more of a gamble because you're paying very little up front with chances of big bills coming on the back end. And you need the referrals and you got to jump through the hoops to get the appointments and get in line and things like that. Where with straight Medicare, you can go to the specialist without a referral and you can go to any specialist you want. You know, you can call around and go to whoever you want. It's a wide open playing field. You'll see here, there's just line item copays each visit. Your primary visit's only $10 to see your doctor, $35 for a specialist. So if you're just going to a few visits a year, this plan, it works great. But if you need to go to a skilled nursing facility and they only have one contracted in San Diego and there's no beds there, you're kind of out of luck. You know, these plans are restrictive with where you can go. I still sell them, but I make sure they know what they're getting into. And most of the time, when people are on a Medicare Advantage plan and they need lots of care, they want out. And it could be an issue getting out. So I don't want to give you all these benefits and bore you here, but they just break down all the visits into manageable copays. And so that's why people like Medicare Advantage versus straight Medicare, because you're not going to get slapped with a $1,600 hospital bill for one night. It'll just be $295. Or you're not going to get hit with a 20%. You know, it's just going to be a flat copay. So that's where Medicare Advantage is. But how we got in here was the dental, vision, and hearing. So this plan does throw in some of that. So you get vision. You're gonna have a VSP vision plan, which is going to be for eyewear. They'll give you up to $305 every 2 years. So you get a pair of glasses. They'll also give you an HMO dental. So the problem with these dental plans is you can't find a good dentist. You know, they're all pretty much bottom of the barrel. And you hear stories of people going in for their free cleaning on an HMO, and the dentist just wants to tear their mouth apart to make a couple dollars. So even though they do come with a dental plan, it's an HMO dental, and it's still not great dental coverage. But you get the glasses. They'll also give you this over-the-counter item where you get an allowance of $100 a quarter to order things like ibuprofen or vitamins, or, you know, this plan in particular works with CVS. And so it's any CVS brand. You get $100 worth every 3 months if you order it. So they do throw in more bells and whistles on the Medicare Advantage side. So that's a lot of the commercials you see come open enrollment is for Medicare Advantage. And some will even give you a Part B rebate. So we had this plan in San Diego. They were giving members $150 back into their Social Security check each month for going into that plan. But then you go and look at the doctors, and they have one medical group in Oceanside, Tri-Cities, and that's it. You know, so it's kind of scary when people are shopping strictly off of benefits, because they don't realize, like, you're stuck with these doctors for your care, you know. And a lot of people do that. They'll see a plan with all zeros and they love how it looks and they want to go with the plan, and they don't realize you're stuck with this crappy medical group. So it's very scary with Medicare Advantage. Yeah, go ahead.
Do you ever have people try to do the Medicare Advantage for 4 or 5 years with the idea that they're going to switch over later?
Yeah. So some people do that, and there's kind of an unwritten rule where if the Medicare Advantage plan has a Medigap policy, they're pretty lenient on letting you go into their Medigap without health questions. So like Blue Shield's a good one because they have a Medigap. United Healthcare is a good one because they have a Medigap. So those companies, they've been letting us do it. It's not written anywhere, but each open enrollment, they let us do it. And they say if there's any reduction in benefit, you can do it. So if there's a dollar change in any of these one copay line items, you know, you can do it. So you just have to hunt it down, find the change, and then you can get them in. So there are some people who want to save money. They don't ever go to the doctor. They don't plan to, and they want to start with Medicare Advantage, and they can do that. But you want to make sure you go with a company that will allow you to go to their Medigap down the road.
Interesting.
So, yeah. And, you know, there's 58 different plans in San Diego County, Medicare Advantage plans. So it gets kind of crazy. But if we know which medical group you want to use, it can be filtered down to 3 or 4 pretty quick. So for people who do look at HMOs, we start with, okay, where do you want to get your care before we look at, okay, you're not going to pay any money with this plan. You know, it's more important with starting with the doctor and also the prescriptions than the actual copay line items.
So that leads me to the question about all the all the commercials, all the flyers, all the information that we get, you know, before we turn 65. How should we handle all that? Once I'm setting a plan, can I just ignore all that? Should I be reading that in anticipation for signing up? How should we handle?
Yeah. I mean, these commercials are getting really good every year. And so they're pretty enticing. But yeah, open enrollment, it's a busy time for me because there are changes every year. If you go PPO route and you stay put on Medicare, original Medicare with a Medigap, the Medigap plan, these are renewable for life and they're not going to change. So this plan G benefit it's a set plan. So the benefits never really change when you're on a Medigap, but the premiums go up each year as you get older. So the time to look at those and shop those out is around your birthday. They have a birthday rule where you can do it. But most of the time you're looking at like a $10 to $15 increase per month. It's pretty standard. You know, unless there's a crazy increase, you really don't have to shop those every year because they're not going up a ton. But there have been some years where companies go up 15%, and you could shop them out. So you can go like to like plan around your birthday with no health questions. That's the birthday rule. So for the Medigap people, that Medigap plan is solid, but you can shop the premium. But you don't have to worry about if the plan's changing a whole lot. It's just the premium goes up. The prescription drug plan, though, is something you want to review. And so that Medicare.gov is a great resource. I go through with everybody. I just do a screen share like we're doing. And I go through that with a lot of my clients during that time of year, just to make sure they know what they're getting into the following year. Also, you see a lot of commercials for Medicare Advantage. So these are also 1-year contracts. And so they do change each year, and they'll add like grocery benefits, like you saw that last year. But you have to qualify based on your income for that. You have to be low income. They'll give that Part B rebate. So the company that was giving the $150, they just went bankrupt. They're selling their company to Cigna. So you got to be careful when you see these benefits they're giving away, because a lot of the time they're too good to be true. And something's going to happen the following year. You might get them for a year, but then you're going to have to move again the next year. So I like the bigger companies like United Healthcare is awesome. Blue Shields, a lot of the bigger companies, they're just more stable. They're not trying to bait people in with all these enticing benefits and then have to switch them because they can't afford it. So if you're going with the larger company, more well-known company, you're much safer, I think. But the prescription plans, they're a crapshoot. Those are something you want to look at, especially if you're taking expensive prescriptions.
Could I give another testimonial here real quick?
Yeah.
Sure. My previous insurance advisor signed me up for something and then said they checked every year, and they didn't. Tyler checks. I mean, they just got their commission and what have you. He really checks every year to see if I still have the best plan. And my supplemental plan includes, it used to be Silver Sneakers, gym membership, and now it's Silver and Fit. And I pay a little more for the supplement, but it's worth it because the gym membership is a significant enhancement to the plan. But I just want to say Tyler earns his money, because every year he says, well, this plan went up a little bit, this one went down, your formulary for this prescription is this and that. So he really does check instead of just renewing you automatically and going on to the next client.
Thanks, Wayne.
Yep.
Oh, good.
Yeah. So, I mean, it's scary for me because my book of business has grown a lot. And so that time of year is crunched down into 63 days or so. It's a very small time. So I stopped marketing a few years ago, and I like word of mouth and warm leads, and I'm not trying to grow this thing crazy big because I still like taking care of my current clients.
That's great. That's good to know. Blake, do we have any other questions coming in?
No, I haven't seen anything on Q&A. So anyone, if you have any questions, feel free to unmute yourself and ask away.
Tyler, can you touch base on Kaiser? They're such a big HMO in so many areas.
Yeah. Kaiser's a very popular plan with employer groups. Typically, Kaiser's the cheapest option when you have to choose from plans, and a lot of people go with Kaiser, and they just stick with them. And then when they hit 65, they do have a Medicare Advantage plan, their Senior Advantage, and it works at Kaiser, and you're just going to be restricted to Kaiser. So unfortunately for me, Kaiser is the only one I cannot sell. They don't use brokers. They don't allow brokers to sell their product. You have to go directly to them. But I'm a little biased because everybody I get to meet from Kaiser, they're coming off of Kaiser. They want to leave Kaiser. So I don't have a whole lot of good to say about them. But I mean, if you've been going there and you're comfortable there, they do have a Medicare Advantage plan. Their medical group is a little unique where they don't take original Medicare. So if you're going with them, you have to go Medicare Advantage. So it's kind of funny. They're both the provider and the insurer. So they're paying for the services they give you, which it seems a little funny to me, but that's just how they work. And they make you get their HMO. So if you're with Kaiser, you can't go get second opinions at Scripps or Sharp or UCSD. All your care is going to be at Kaiser. So yeah, that's pretty much it.
Thank you.
That's good. All right, anything else that we should be aware of as we're thinking about Medicare?
So I'm just thinking, let me go through some of my slides here. The beginning is a little confusing because if you're still actively working, most likely you're going to want to delay Medicare. So I always compare, and what happens though is that the younger spouse is on the work plan as well. And so if they leave and go on to Medicare, the spouse is left hanging. There's no coverage. So a lot of the time, if you're still working and your younger spouse is covered, you're just going to stay put on your work plan. What you can do is you can get Part A of Medicare. So Part A is free. You're going to get your Medicare ID card. It says Part A only. And that helps the transition into Medicare when you retire because you already have your Medicare number and all they have to do is activate Part B. And so a lot of the times I would recommend people to get Part A. It will also work as a secondary insurance. If you have a work plan and you're hospitalized and they charge you more than $1,600, Medicare will kick in as a secondary and it'll put a stop to your bills at the hospital. The only time you do not want Part A is if you're contributing to a health savings account. You can't have any parts of Medicare and contribute. So if you're on a high deductible plan and contributing to a health savings account and you're going on to Medicare, you're turning 65, you don't want to do anything. You don't want to get Part A or Part B. You just want to stay put in that plan. So yeah, there's a few rare cases like that you kind of run into. And they don't make it super simple with Medicare, unfortunately. So there's a lot of different avenues depending on your situation. So yeah, if anybody wants to talk later, whatever, I'm open for it. I am going to be out of the office next week. I love to surf and I'm going on a little surf trip. I'm splurging on a week away from the family down in Mexico.
Oh, fun. That's
my
awesome.
My calendar is full of board meetings all week next week.
Very good. Very good. Well, thank you very much. This was awesome. And for those of you that are listening now or in the future, listen, and you have friends or you have additional questions, feel free to get in touch with us. And then we can pass those questions along to Tyler or help connect you with Tyler. But I appreciate everyone joining us this afternoon. And thanks so much, Tyler. This was awesome.
All right. Thanks, David.
All right.
Hey, Thanks, Wayne, for all the nice and kind words.
You're welcome. Take care.
Okay, we'll talk to you soon.
Bye-bye.
Right.